Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber, the economic development arm for the city, but I'm also helping out with some of the other cities and counties and working on behalf of basically a lot of the chambers and the economic development authorities in Boulder County to provide you information, get your questions answered. We're joined today by only two speakers. We have Lane Drager and Tessa Hale from Boulder County Public Health. Lane's going to go through kind of data on where we are in Boulder County. I know I've had some of you email me some questions beforehand. You should cover most of the questions. And then if there's any additional, please submit them in Q&A. And then Tessa's going to talk about the vaccine verification program that launched a little over a week ago with applications to allow you to basically be able to remove masks if you prove that you are doing certain steps. So it's an application process. She's going to run through it. She's going to talk a little bit about some of the questions that are coming up and answer your questions today. So we'll start with Lane.
Thank you, Corinne, and good afternoon, everyone. I'm going to share an update on what our current data is looking like in Boulder County and try to share some other answers that to questions Corinne had forwarded. So we'll start with the tracking that we've been showing you since the beginning of the pandemic of where we're at with case counts. And we are seeing some positive trends in Boulder County. As you can see towards the end of that graph, we are seeing a little bit of a downward trend. So that is incredibly positive. And certainly I think the efforts in Boulder County are a lot of the reason for that. So we are at 127.2 cases per 100,000. So you can see where we've been throughout time, and again, trending down. That is not the same case for all of our neighbors. Some of our other peers are, but as you can see, this shows a little blip up, but overall in the last several weeks that has gone down. But we're at 137, Larimer's at 233, Weld's at 299, Bloomfield 173. So we're faring better than many of the metro area counties, but we know that influence from all of our peers is still present. So, but it is positive to see a little bit of a drop in Bloomfield, Jefferson, and Adams as of recently. So. This is that busy slide that's tracking all of our age demographics, but we're in the last 7 days, the highest cases were among that 23 to 34-year-olds. So again, one of our age demographics that continues to be a challenge as well in the vaccination effort. So that's an important piece to continue to focus on, that age demographic getting vaccinated, because obviously that's where we're seeing cases. Still seeing a disproportionate representation of cases in Longmont. We're at 45% of the cases in Longmont, with 19% in Boulder City. The actual case breakdown over the last week, 80 cases in the city of Boulder, 187 in Longmont. And then Lafayette, Louisville, and Superior, there were 82 cases. And then the rest of the county, the other municipalities in unincorporated county accounted for 63 cases. So again, that different representation where we're seeing 19% of the cases in the city of Boulder, whereas 32.5% of our population lives there. And then 45% of the cases in Longmont, when 29.5% of our population lives there. So again, a big overrepresentation of cases in Longmont. I'm going to give you at least a little breakdown on what the hospitalization status looks like. So the north central region where we are located, the ICU availability has dropped to an average of 9%. And when I looked on the state today, it looked like it was maybe down to 6 or 7% availability. The North Central Region staffed medical surgical bed availability also dropped down to 11%. And the hospitals are reporting tight staffing. So again, that stress on staff shortages. those hospitals are continuing to take patients from other states, so that continues to also be a stress on them. And the transfer center plan is activated at level 1. So non-emergency surgeries are being postponed. So some additional steps to try to address their shortages. This is that same tracking of our cases, but showing that while we are seeing that downward trend over the last several weeks, we are still beyond our epidemiological capacity to do that contact tracing and case investigation work. So we still need to come down quite a bit to get back to a more manageable level, and ideally get even lower so that we can start to think about relaxation of the mask requirements. We've had 11 deaths since June of this year. So again, going to keep watching what's happening with our kind of most severe impacts. But you can see with the surge last fall, that was the bulk of where we saw a lot of those impacts last year. Our vaccination rate, this is kind of where we're at, with 69% of our population have at least had the full course of vaccine. That's 77.9% of the eligible. So again, those age demographics that aren't currently eligible being pulled out of that percentage. So we still have a fair chunk of our population that need and are eligible for vaccination. So that's still our silver bullet. That is our solution out of this pandemic. So we are going to continue to push throughout the community, especially in those areas where we have lower vaccination rates. And here's resources that I know Corinne will continue to add in the information she shares out with everyone. And if you want to, Corinne, we can either take some questions or we can wait till Tessa's done.
So I see some people have their hand, one person has their hand up. If you could put your question in the Q&A, that'd be great, or the chat if Q&A is not available to you. I'm not able to actually unmute you because we have a lot of people on this call. I'm going to ask the one of the questions that wasn't covered that came in via email, and that is the percentage of hospitalizations that are immunized. So if you could give a best estimate to that. I know we talked a little bit beforehand because that will finish off the data part of it, and then we'll move on to Tessa because vaccination is her topic.
We don't have the Boulder County number statewide. It's 77% is what the state is reporting of those hospitalized or unvaccinated. On a call yesterday, Larimer County had shared, and I know that their system is incredibly stressed, that I think it was 93% of their ICU were unvaccinated. So I don't have an exact count for our Boulder hospitals, but I know it has ranged around that 80% is what I continue to see for figures.
I'm going to ask you a couple more questions before we move on to Tessa. Our current numbers are in the over 100. In order to start the 21-day countdown to be able to take off masks, we have to be below 50, correct? So we have to be in the yellow. So we're not quite close to even start the countdown on that 21 days, correct?
Yes.
Okay. So a lot of people send a question like, how much longer? How much longer? And those case counts have to get below 50, and then we start the countdown of the 21 days. So that is the number we have to reach. I'm so happy to see it trending down though. Question about requirements. We know there's a mask order in place, but are there requirements in retail to still have sneeze guards or any of those mitigation efforts?
There's not a requirement. We would still encourage folks that all the practices that were successful last year, those strategies, those are still going to be successful strategies, but the order does not require any of those things.
So no requirement of the social distancing, but we know social distancing is one of those mitigation efforts the plastic barriers. Some people call them sneeze guards, but you see them as that plastic barrier. You know, a lot of those are still recommended just to keep that layered approach that you've talked about.
And the one exception would be if it's already been required. So if it was a food establishment, like a buffet type of thing, self-service, those would still be required because they were before COVID.
It's good to know. Okay. Someone said they're confused that your numbers on your graph show close to 159, but the website says 133. Where's the discrepancy? Is it that the website's not updated as regularly as the numbers that you present, or?
The numbers I present are probably what are outdated. So those are pulled on a weekly basis. So instead of us all going and grabbing things at random times, we try to grab from our data folks. And so those are reported on Tuesdays. So my slides are a few days old.
So we're still above 100. So whether we're 133 or 159, we're still above 100. And again, we need to get it below 50 to start that 21-day countdown. All right, I'm going to leave. I have another question in the chat, but I'm going to leave that for after Tessa's presentation. It's a little bit more about vaccination. At this time, I'm going to have Tessa share her screen. Tessa Hale is helping lead the vaccine verification program for Boulder County Public Health. I know she's been working a lot of hours and doing a lot of work over the last couple of weeks. So she's going to go a little bit through the program and take it away, Tessa.
Thanks, Corinne. Yeah, so I will share the details of the program for people who are not yet familiar, and I'm going to share how it's going and what kinds of businesses have applied. And throughout it, I'm going to address some of the questions that have come up over the last week and a half as we've launched this program. So the vaccine verification program is a voluntary program that any facility that meets the requirements that is not excluded because of a Colorado Department of Public Health and Environment reason, like a long-term care facility, facilities that have kids who are under 12, federally regulated facilities, and others like that. Others, and it's all listed on our website, which is on this link here that Corinne will send out. Any facility that is allowed to apply and approved, individuals can remove their masks while they're indoors. And just one question that has come up is we were calling it the fully vaccinated facility program. We've switched to the vaccine verification program because what we decided to do was to allow for a small number of exemptions, medical and religious exemptions to happen. And so this is a more accurate description of the program that we're running. And my slides are not advancing, so I'm going to stop the share for a minute and try to fix this.
While you're doing that, I'm going to have Elaine answer this question that just came in, which is why Boulder County has a mask mandate when some of the surrounding counties that are higher do not have an indoor mask mandate. And are there other counties in the state that have indoor mask mandates like Boulder County? You're on mute, just to let you know. I've muted you.
We put that in place, obviously, as a strategy to address where we're at with the high risk in our community. So that's why we have it. Our neighbors, I know, have considered there's likely some inability to put some of those strategies in place, that there's not the political support to do it, rather than that there isn't a need to do it. But I think you can see, especially our neighboring counties that do not have mask orders, there's a radical difference in what's happening with transmission there. Also, our vaccination rates continue to be some of the highest in the state. So it's really the layered mitigation strategies that we are implementing that are starting to be successful. And I know there's continued dialogue across the state, but as far as why others don't, that would be individual by county. I can't answer the exact questions, but my best information is that there's probably a lack of political support to do it.
And there are other counties in the state, like Pitkin County, and one other is also doing an indoor mask mandate, correct?
Eagle County has an order, I think, identical to Boulder County's. And there's other counties have other orders, different strategies where they have put vaccine mandates in place. So there are other counties that have taken steps. Other counties have orders for masks in school situations. So it isn't that Boulder County is the only one that has orders. There are a lot of counties that have orders, and some do include masks.
Thank you. So are you able to get it to advance?
Yep, it's working now, thanks. So these are the requirements for the program. The first is that there has to be a written policy, and this is something that it doesn't have to be very involved. It doesn't have to be pages long. It just needs to cover all of the parameters set for this program. We do have a checklist on our website, and I have a link to that in a future slide. So if you go to that checklist and you just make sure that you respond to every requirement there, that is the best way to figure out what you need to do for this program. And so in addition to the written policy that requires proof of all individuals entering the indoor space, with the exception of 5% of people who may have religious or medical exceptions for that, we want to, you can remove masks once you have proven that you have a way to monitor and track who in the indoor facility is vaccinated and not vaccinated. We also request or suggest that you have additional mitigation strategies, and I'll talk a little bit more about this. But the questions that most frequently come up about these written policies and the 95% vaccination rate are, number one, what about kids who are ineligible for vaccination? Those kids count towards your 5%. So if they are ineligible, they cannot be in your facility wearing a mask, or you cannot say that 95% of the people who are unmasked are vaccinated, and then allow other people who, if you get above that 5% threshold, they cannot come in wearing masks. So it's not an either masking or unmasking, it's a 95% vaccination rate for that indoor space at all times. It doesn't have to be an all or nothing deal. So you could have a class, you could have a part of your facility, you could have times of day that are fully vaccinated. So you can create a hybrid model that works best for your business. And we've seen a lot of that with places that have a warehouse where maybe everyone in the warehouse is fully vaccinated, and then public facing space, people are wearing masks. In fitness facilities, there are classes that are fully vaccinated, and other times people are wearing masks. So we're seeing a lot of that hybrid model coming through. Another frequently asked question is, what about delivery and repair people coming in? If you have a fully vaccinated facility and you have a repair person just coming in or delivery person for a few minutes, you could either opt everyone mask up while that person is in your space, or that person could just, if they're in there for a short time, they can come in and leave, but we do think it is most respectful just to have everybody mask up for that time. And those are the main questions we're getting. I'm happy to answer other questions as we go through this. So the written policy checklist, there's a link to it here. These are the requirements that need to be in the written policy to meet the standards for the program. So essentially, you're addressing how your employees and staff will provide proof of vaccination, how people from the public, if you have people from the public in your facility, will be providing proof of vaccination. If you're allowing unvaccinated people into your facility, how you're monitoring that threshold. If you are allowing exemptions and exceptions, how are you doing that? And again, we just really want to know, how are you maintaining that 95%? As far as proof of vaccination, there are many different options for how you can accept that. There's the original record card, a hard copy, a paper copy. It could be a photo on a phone. My Colorado app, we highly recommend that. That's a great resource. And there's also third-party apps. So far, we've seen MindBody and Union Fit as two fitness facilities using those apps. So all of that is available in the application for you to check which kinds you're using. And then with recommended additional mitigation strategies, these are a lot of the things that for those of you who participated in the 5-star program, you're familiar with. A lot of it is different kinds of practices that we implemented at different times of throughout the pandemic. And for unique situations, it's helpful for us to know exactly what you're doing when we review the applications. We're able to have a better sense of what kind of risk is involved with people being unmasked in your facility. And then once approved, people are receiving signage. There's 2 different kinds of signs. There's the fully vaxxed at all time sign, and then there's the vaccination at designated times. And we welcome you, if you have vaccination at designated times, to create your own signage to identify what times or what classes that those refer to. So here is how things are going. So far, we've had 201 applications. We've been working really hard to try to approve as many as we can as quickly as possible. 133 so far have been approved, so we're really excited about that. This shows how throughout the county, different municipalities, and as you see, Boulder's at 68%, Longmont at 13%, Louisville at 9%, Lafayette at 5%, and Niwot at 1%. So we're seeing everyone from across most municipalities from across the county applying, mostly in Boulder. We're hoping to continue to do outreach and support people from everywhere across the county to apply. In terms of the kinds of facilities that are applying, primarily offices, over 50% are offices. And then next we have gym and fitness and dance studios, and event venues, community centers and houses of worship, retail, and then other falls into one-time events or manufacturing facilities or labs or other kinds of facilities like that. And then, in terms of people who have applied, where we've had to go back for more information that upon their first attempt at applying, it hasn't worked out. The most common reason is that there's a place to upload the policy and there is no policy uploaded. So that's the biggest reason for a fail there. The second is that the policies are missing the requirements that I shared earlier that are on that checklist on our website. And then another reason is that there's no proof of vaccination. So in the policy, it doesn't say that this is how we're tracking if people are vaccinated or not. And then other are just a host of different reasons. Maybe they don't qualify for the program, or just no easy explanation reasons for me to provide right now. Of the 200 applicants, 13% have participated in the voluntary demographic survey. And so those are the outcomes here. I would encourage anyone who is applying to fill out the demographic survey. It's really helpful for us to know, and we want to support all businesses and the opportunity to participate in this program, and so we can outreach to those facilities throughout the county if we have a better sense of who is and isn't participating in this program. All of the approved facilities are listed on our website. There's a link here. And this is just a way for, we're getting a lot of feedback from the public that they're excited to know that they can look up and see places to go that are fully vaccinated, and making decisions on where they want to go based on that. So this is updated right now. It's being updated on a weekly basis. We're getting it squared away to update on a more regular, hopefully daily basis starting next week. And then here are the links of where to get the application, and then also information on the masking requirements that set this program into motion.
And just to clarify, I did put the link to the program as well as the link to this to the checklist in the chat for anybody that's wondering, because it's hard to write down. And then I send them out in the emails with the recorded videos. All right, you guys ready for some questions? Can you just clarify, let's say you have a front space that's public facing, but you have back offices. can you apply just for the back office area? So it doesn't matter if kids are coming into the front space, it's just your back office area, and then how you deal with people going between those two.
You can absolutely do that. And so when you apply, there's a question about, are you applying for your full facility or part of your facility? So you would just provide a description of which part of your facility you're requesting for the program. And if you have people going between, I guess I need more clarification, because you would need to be
If I'm
masked.
going from the offices to the front facing part of the building, I probably need to put my mask on at that point
Yes.
when I go to the non-verified vaccine area.
Yes, thank you, Corinne. I wasn't sure if you were saying people were going to be hanging out in the vaccinated area, which would not be okay. Yes, wear a mask as you're transitioning between spaces, please.
Okay, does full vaccination include boosters? Either one of you can
Great
answer
question.
this.
No, full vaccination is 2 weeks after 1 dose of Johnson & Johnson or 2 weeks of Pfizer and Moderna.
Okay, and right now boosters are actually not available for all groups. There's just only certain populations that can get booster shots right now as dictated. And there's no booster yet for J&J, correct?
That is correct.
All right, what's your experience in the time from submission of application to approval?
That's a great question. It really depends on the complexity of the facility. So offices that don't have anyone from the public coming in, where everyone's fully vaccinated, is a really quick turnaround time. Places that have a lot of public coming in, that have a more complex system for tracking to maintain the 95% vaccination rate indoors, or places that have multiple sites, are taking longer. But we're generally, I mean, you saw the statistics. We have approved 133 out of 200 applications. So we're turning it around so far within a week.
Thank you. And let's say a facility, we've talked about this in the past and it's come up a couple times on calls I've had with people this week. Let's say they're a little small, they're a smaller business. So 20 people or less, you really even can't have one unvaccinated person in your space to meet the 95%. What do you suggest to those smaller businesses or businesses that, they don't have the mass numbers to be able to have a lot of unvaccinated, or that flexibility of having a child come in or so forth?
Thank you, Corinne, for that question. We encourage those businesses to apply. Our goal is for as many businesses are interested in this program to be accepted and participate. And so we are able to make accommodations for small businesses if they have an instance where they wouldn't meet that 95% threshold because they are too small. And so we will take a look at the full application and make decisions based on the intent of the people wanting to participate in the program.
So apply, get your feedback, work with Boulder County Public Health, because your goal really is to get as many facilities vaccine verified as possible, correct?
100%. And I will say too, just in terms of that, I feel like, we have seen a few instances like that and we have approved facilities. So it would just mean that we would probably have a conversation with you and look at your additional mitigation strategies, but please do apply.
Yeah, I had one yesterday say, if one employee joins and that person's unvaccinated, we would then jump below our 95%. And, everybody would know that they had to put masks back on because that new employee. And I said, apply, work with Boulder County Public Health. I mean, the goal of the program is not for, the whole facility to know that the person they just hired is unvaccinated, and for this, this type of dilemma to start.
Right. I mean, the intent of this program is to support people in safe places. It's to support more people getting vaccinated. And we've in fact heard feedback from a few people that this program has encouraged either members or their staff to get vaccinated. So we're really happy with the way that it's trending. And we really do want to support businesses in applying.
Great. Yeah. Everybody that calls me, I with those types of situations, I encourage them to apply. And then work through the policy. All right. So is there anybody from your staff that goes out to the facility to make sure what they put down on the application is always in compliance?
We do not have a regular inspection set up. We do say in the application that people are agreeing to have a compliance check so that it is possible that public health could come out and see if they are in compliance with what their application reports. And we're also going off of complaints that come through the public. And so that's part of why we're printing out listing publicly who's participating in this program. So if someone goes somewhere and sees no one's wearing a mask, you're able to tell, okay, well, they're actually a fully vaccinated facility, and people should have signage up also.
And on the sign is a QR code that goes back to the page, just like we did with 5-star, in which if there is a complaint, it can be put in through there, or a question, or people can get information about the program directly from the signage as well. Okay, so why 95%? Is that the goal for the community? Why? I know that we've heard it on a couple of the other calls. Why 95%?
Yeah, 95% is what we understand to be we would have immunity, right? If 95% of the community were to be vaccinated, then we would be able to get back to operations as normal. And so we feel like that is a standard. And it's also to allow for those instances when someone medically is exempt from getting a vaccination. We don't want to create a hardship for businesses and facilities that can't control that.
And I heard Trina talk about in the past, it's also the number above which to use at with their vaccine mandate. And so there was a good precedent there as well. Okay. Does the program allow for verified natural immunity and antibodies from COVID recovered individuals to count toward the certification?
No, we are just using fully vaccinated proof of full vaccination for this program. And the reason being that there's not a standard way to account for that. And I don't think we have the science there yet to know that the length of immunity, the kind of immunity. So we're going with full vaccination.
And in the last two webinars, Dr. Urbina, well, that's in the gyms and fitness webinar, Dr. Urbina, the Chief Medical Officer, and Dr. Goodral both covered this topic about why vaccines and not also the immunity from the COVID. So if you'd like to revisit those answers, they are in the previous two links that I sent out for recordings. Okay, I think this question's for you, Lane. Sorry, Tessa, but Lena, you're on. So our first food responders are fully vaccinated. Does this and a mask and gloves while preparing food meet current safe food handling standards?
There isn't a requirement in the food regulations for vaccination, but yeah, if you have that in your facility, I think that's fantastic. And then when you're handling food, you just need to comply with those safe handling practices, which could include utensils, gloves, just as long as you're not using bare hands with food that's ready to eat.
Thank you. I knew you could cover that one because that's one of your other hats. Follow up. So how many weeks, months after having COVID is a person eligible to get vaccinated? When we write our policy, we need to address how we're handling employees who aren't vaccinated due to the fact that they recently had COVID. What's a reasonable amount of time to write into the policy?
That's, let me first say, I think that's a question for a medical professional to ask a doctor after I've had COVID, when can I get vaccinated? That isn't something that would need to be specified in a policy. It would just be, what is your strategy for ensuring that all of your staff are fully vaccinated? Or,
how are you accounting for maybe alternative work situations for those people that are unvaccinated? You've had a lot of people, say we're going to have this area be the vaccinated area and then this other area, or unvaccinated. We're 100% vaccinated inside our facility. The 6 people that aren't vaccinated work from home. Those types of situations have come across, and at least in questions and people that have commented to me, but I know you've gotten them in applications as well.
Yeah, thanks, Corinne. There are numerous offices that are just having people, either they work remotely all the time if they're unvaccinated, or they have a couple days a week where everyone's masked when the whole team is there, including the people who are unvaccinated.
So it could be a space, but it also could be a time. So Monday, Wednesday, Friday, it's your, vaccine verified days. And then on Tuesdays and Thursdays, everybody wears masks and you're going to be below your 95%.
Exactly.
And that's how, some of the fitness studios are doing it. They're doing certain classes or certain times of day, as well, if they don't want to do their full facility. Hey, Lane, I think I'm going to ask you this one. When will we revisit the mask mandate in Boulder County?
The way the order was implemented, it will stay in effect and it will relax the need for masks based on our risk of transmission in the community. So I think Corinne covered this earlier in the webinar. So as we're tracking those case counts, once we get down into below 50, that's when we would relax that mask, assuming we're stable there for 21 days. So we already have built-in metrics to relax the need for wearing masks, but we also know that that surge could switch things back the other direction, so that if we start to see trends going in the wrong direction, masks would need to be worn again. So it's really based on that metric of tracking.
So follow up to, so we know that the order's in place. It stays in place. It's what our metrics are that then allows us to revisit whether we have masks or not. So we're not putting in an order every 30 days, waiting till that day, wondering if it's going to be, it's in place. And then, the metrics help us decide whether or not we wear masks. Follow up to more data question. With such a high vaccination rate, what data can a business point to when somebody asks how well mask mandates work versus vaccination rate, if there's proof of that? We're struggling with our customers to find and show any proof that mask mandates in highly vaccinated communities have any impact.
I mean, you can just look at the different trends. I know that there has been analysis for school systems, specifically looking at schools that have mask requirements versus schools that don't. And, it's very obvious the ones that do have less instance of disease. We're tracking, obviously, as are the whole metro area, what our case counts are. As I showed earlier, we are the lowest in Boulder County, and we have some of the most stringent requirements. We also are seeing that combination of mitigation strategies are likely what are creating our ability to be lower, is continuing to push and seeing good vaccination rates, although we still want to see those be much higher, as well as then having multiple mask requirements.
And some of the counties that have those higher numbers have similar vaccination rates, correct?
I don't have that in front of me. I know we do not have the highest rate, but we have one of the highest rates within the metro area. I think Broomfield has a little bit higher vaccination rate, but they also have a little bit higher case count and do not have masks.
So I put in earlier the link to the data from the CDC, the link to the state data, and the link to the Boulder County data. What I'm going to put into the chat right now is the Denver site, and I send this out in the emails as well, which allows you to basically pull up county by county or lay county over other counties within the tableau that they have on their website. So I'm going to put that in there. Is there enforcement happening for businesses still not enforcing mask mandates?
Unfortunately, there is. We've continued to try to work with folks to make sure that they have the resources and understand what is required. We know that it's difficult, especially in certain situations, to get your patrons to comply, but it's the effort and the steps people are taking to try to adhere to the order. That's what we're really looking at, but we have some facilities who are really not doing that. So those are the ones that are seeing more activity around enforcement.
And we covered this on a previous call, but enforcement starts with education. So you start with education, and then if it gets to the point in which there are quite a few legal measures that Boulder County Public Health can take if you have to go past the education. So Tessa, this question's for you. So you mentioned tracking of people that are vaccinated. I know I get this question a lot. Do businesses have to keep a copy of the vaccine card?
No, not at all. all we want to know is that you have a system in place for tracking it. And so it would be whether you want to have a Word document where you check off that you've seen it, or you have a third-party app that tracks it for you, but we are not asking people to maintain those records.
So if you have to keep track of the person's name and whether they're vaccinated, or just that you check their vaccine record and you're at your numbers?
We would need to, so for example, if you're a venue, a music venue, right? Perhaps you are checking a card for every person who goes in. We don't need to know that. You don't have to have the name of all those people. You know, if you're an employer and you have 20 staff, maybe you're just checking it on a list you have of those staff names. I think we don't need to have a copy of the record or a copy of the name and a check. We just need to know what your system is for checking those.
Okay, so I think that's, and some gyms are keeping copy of the person's status in their records. That's why you mentioned those, or event, some of the events have those similar type software programs. The reason they're doing that is for people coming back. They don't have to check it each time. They know that they've checked that person, that they have a record of their vaccine status. But I think a lot of people are worried about, your hostess checking vaccine cards and then writing down names and writing down whether or not they are vaccinated.
Right. Yes, we're not trying to make this cumbersome. We just want to know you have a process in place to check the vaccination status of all the people who are indoors in a way that can guarantee you're at the 95% threshold.
Okay, thank you. By the way, the Denver site that I just put in the chat is apparently under construction. So in the meantime, go to the state data site, the Boulder site, and then CDC site. And then when the Denver site is back up, that it's nice and convenient how you can look at different counties. It's under construction. So I appreciate the person who did go to it and let us know that that's the case. All right. So you mentioned delivery and repair. I know you get a lot of questions. We all get a lot of questions about that. And you said, mask up, have them deliver outside. Could they count towards your 5%? Let's say you have 100%, if they feel comfortable and you have 100% vaccination, you have one person coming in, could they count towards your 95%?
Yes, that would be 100% possible. And we would just also suggest, as a mitigation strategy while that person is there, for people to mask up, and also just to be sure that your staff, employees, and guests who are 100% vaccinated would feel safe with someone coming in with an unknown vaccination status. But to your point originally, Corinne, yes, that person could come in because they would count towards your 5%.
If someone has a special music event in our church, do we need to check the vaccine cards of the audience in addition to the participants?
There is a performer exception in the order, which says that if all of the performers are fully vaccinated and all of the audience is masked and they're 12 feet distance from the performers, then that is fine.
Okay. So this doesn't necessarily need to be under the vaccine verification program. If they're just talking about their performers, they could be covered under.
If they want their performers to be unmasked on stage, they would need to apply for the performers.
Okay, and then they have to stay 12 feet away from a masked audience. If the audience, they want the audience to be able to take off masks, then they'd have to check verify the vaccine status of the audience and apply for the full facility, correct?
Exactly.
What's the best practices for entering a business? Sorry, I'm trying to make sure I understand this question. Okay, what's the best practice for entering a business that has law enforcement or security on the place, and you observe unmasked patrons? Should we expect to be enforced and be able to ask local on-site law enforcement to engage with patrons? Lane, you might want to read that one in the Q&A just so you understand what I just said.
Yeah. So I don't know the situation of why there's law enforcement present at the facility. That's, I guess, left to that individual facility if they've hired someone. I know we have heard some businesses have hired security to make sure to share that masks are required when people walk in, but I don't know that situation that they're presenting. Certainly, if there's non-compliance, that can still be shared with Boulder County Public Health. Ultimately, we have authority to address situations where facilities are not compliant, but there is exceptions in the order if they're talking about law enforcement personnel not wearing masks. So if they are conducting their public safety activities, there are provisions where they potentially don't need to wear a mask. So I don't know if that was the scenario that they're describing, but just because law enforcement are there, that doesn't necessarily mean they're there to enforce the mask order.
I think that's how I would have interpreted the question as well. So Tessa, can you clarify something for us? I had to clarify this with 5-Star as well. Can you explain who H2 Manufacturing or H2 Solutions is, and why people might be getting emails from them, or why their logo is at the bottom of the charts you showed on the program?
Right. So like with the 5-Star program, we have contracted with H2 Solutions to support the implementation of this program. So they are helping us with the application, with the technology piece, with the reporting and data side of things. So you may hear from them directly when you receive an email. They are running our hotline, and we are in constant contact with them on this project.
Yeah, and the hotline email address even has H2 Solutions or a different ending. It doesn't say Boulder County, so I just wanted to clarify that for individuals. Are there any more questions out there? We have Lane and Tessa right now, and we didn't go over. I think the last webinar was 111 minutes. We're only at 47 right now, so I appreciate everybody sticking with us. Any other questions out there? Otherwise, continue to apply. If like Tessa said, apply. Start that process. And then if you need to work on the policies, you need to go through the checklist, all of that stuff will be reported to you. And you are working with a lot of businesses to help make this work for them. Lane is around. We're gonna maybe do it in 2 weeks. Hopefully, if we do this webinar again, it'll most likely be in 2 weeks. Again, we'll cover data, we'll cover any hot topics that come up, and then potentially have Tessa back to talk about the program if there's a lot of questions still about that. The key though is, get those vaccines up. Let's get back to normal. Apply for this program if you want an option to be able to unmask, and we have to get below 50 cases per 100,000 to start that 21-day clock in order for the order to then move to the unmasking. So I think those were the main themes today. We'll see everybody in 2 weeks. Thank you, Lane. Thank you, Tessa, for being available to answer questions.
Thanks, Corinne.
Thanks for hosting.